called cutaneous small vessel vasculitis. So all her left side was in constant pain. She was constantly going in and out of hospital with severe edema, severe pain. People with complex regional pain syndrome, their pain is so high. Basically, the tumor necrotic factors in the brain, they are overfiring. Interleukin factors are overfiring. Usually it's 3, 6, and 9, 12. And it's sensitizing the peripheral vessels through the neurovascular bundle. Now, this was her tumor, as you can see with the arrows. There it is in the MRI, causing the edema. It was removed. She consulted multiple pain clinics from anesthesiologists. She did RF, and she was taking over 18 prescription pills. Of course, as you can see, Zoloft and so many other pills, which are neurotropic medications, plus gabapentin, Neurotin, Lyrica. Nothing was working for this lady. Now, this is the result after using Neuronica. What we were doing, we were targeting both the cortical tracts, the brainstem tracts, and the peripheral tracts. Now, before you can see, that's in her home, the edema, how much pain she had. It was all on the one side of the body. She was taking all these medications, chloroquine, antihistamines, cyclophosphamide, Plaquenil. After we treated her, all these were seized. The only medication she was taking after our treatment was Xarelto. It took us 3 to 6 months to see this long-term potential. In neuromodulation, when you're stimulating, it doesn't matter if it's called RTMS, it doesn't matter if it's called tDCS, tBCS, photomodulate, anything that affects the neurons, our 85 billion neurons in there, synapses, just remember it's called a long-term potential. And where current goes, just like with Neuronica device, the tDCS, blood flows. It's called a neurovascular coupling, and it was introduced by Professor Maram Bixen, which happens to be a good friend of ours. This is a patient in the hospital. She was always being admitted in and out with immense pain. She wanted to cut half her body away, and she was suicidal as well. She had a difficult relationship with her husband. She was in divorce, and you can imagine what was going with her. Look at her fingers, the blotchiness, allodynia, even wind was causing all this pain. That's her in the hospital where they bandaged her, and all the edema and lymphedema spread all the way up to the axillary glands, and she said enough. She discovered Sozo Brain Center, which we specialize in neuromodulation and in chronic pain management, which happens to be one of our most favorable fields, not for people, but for us. We did all the histopathology, as you can see. We saw dermal blood vessels, which shows perivascular inflammation. You can see here on the surface, but under the surface, cutaneous, subdermal, you can see all that perivascular neurotrophilic inflammation. Where you get inflammation in the brain, they are called your immune cells. They're called astrocytes and glial cells and oligodendrocytes. Where you get inflammation in the peripheral, they're called the neurotrophic, so the white blood cell inflammation. And this is the patient basically in 6 months. My professor from Sydney, Dr. Nick Lucas, has come and trained with Sozo Brain Center. He is pushing Sozo with Neuronica device to be approved and regulated as it is in Thailand right now. The patient is pain-free, symptom-free, and she's been like that for the last 2 years. She's only taken for prophylaxis, Xarelto 5 milligrams.
The patient that was suffering for
So this is the patient now, as you can see. We're going to examine her using dermatomes, myotomes. As you can see, she's had multiple surgeries. I'm just going to push it forward.
pain here, even when it's
She had pain all over the body.
Something was going to happen to me. Yes. All these things. Продължавам с Sozo.
From the time you come to Sozo.
August 2023.
From August 2023. How is your life right now?
How is your life? She will give a number to it, numerical number.
From 1 to 100.
I'm at 80.
I'm 80% better. She has gone back to work and she's working now. She's off her disability benefits. We can apply neuromodulation using basically neuronica, using mirror therapy, so mirror neurons. This is a lady with SUDEC. She had a fracture of the wrist. She placed the T-plate and she had constant pain. The orthopedic surgeon removed the plate, removed the screws. There was no damage with the EMG, but she had complex regional pain syndrome. She went to a pain clinic. She was still suffering. However, we worked on the patient. You can see she's in pain with the pinroll. There she is. It doesn't matter if it's the radial nerve or the medial nerve. Okay. She had pain all over. All this area was sensitized. By using neuromodulation on the primary sensory area, you can see later, this only after 4 sessions. 4 sessions. And you will see her movements have increased. She was doing physiotherapy for over 9 months after the surgery. Nothing helped. And you can see now her range of motion, flexion, extension, improved. So this is what you can do with the power of neuromodulation with people with post-surgical pain or complex regional pain syndrome. As you can see here, we have her right hand, which is the affected hand, inside the box, and we're modulating her brain right now. Here we had a neurologist from Germany, Dr. René Hasse, which now has moved this system to his teaching college in Germany, using neuromodulation with mirror therapy. This is a very nice case. Now, this is a very severe case. It's called SCA, where we're using neuromodulation. We are combining here TPS and tDCS. tDCS in the terms of neuronica, which is 2-channel. This is a condition, it's an autoimmune condition. It's affecting basically all the motor tracks, both in the brainstem, as you can see here, the motor tracks here. You can see the demyelination, so that's gliosis, there's an inflammation there, and also the cerebellum. And you can see all that basically infiltration. There's a basically degeneration of the brain stem and the cerebellum. This is the first time he came to us. We observed him. He's had this for over 6 years. And he's got severe cerebellar ataxia. Here we're doing the examination, our neurological clinical examination, to walk forward, and he's having difficulty. He cannot perform a simple test. You can see how severe the atrophy is with the cerebellum and right through here with the brainstem. Of course, there's more tests we do, but I'm just showing you a few movement disorder tests called Romberg. Now you can see here, he's got a positive lower motor.
Take a photo.
So I'll show you again. Babinski test. Positive lower motor neuron below the midbrain. That's on the right side, and you can see the tracks here. He's got positive upper motor neuron.
There it is. Take a photo.
As you can know, what upper and lower. So it's very important in neuromodulation to know your neurology and your anatomy. Here you can see he's got resting tremor, essential tremor, and here you can see he cannot balance at all.
Okay.
Severe ataxia. So I will show you one more time. And now let's start doing a combination of TPS with tDCS. Now we are using shockwave, pulse wave, ultrasound. It's 0.2 to 0.25 millijoules. And we're targeting the cerebellum and the brainstem.
Simulation, as you can see on the screen right now, we are in the cell, which is M1 on the right.
Now we're targeting primary motor area, which is M1, M2. And this is after 5 sessions.
TPS plus tDCS.
So using Neuronica, tDCS, 2-channel, and TPS, transpulse stimulation. So this is only in 2 weeks.
5 TPS plus tDCS.
Only in 2 weeks. I want to thank my staff for this. You can see now how he's walking. Still his gait is open because he's got problem with stabilization and movement control, but you can see he's not using his assistance. Now this is Neuronica, tDCS. We're targeting the cortical spinal tracts. We're using C3, C4 or F3, F4 and cathode at C7, T4. He's walking for the first time.
And all you're doing now, you're doing anode
after 5 years.
And cathode at level. This is a severe spinal cerebellar ataxia with severe atrophy of the cerebellum, the midbrain.
So it's very important to incorporate both central and peripheral.
With our assistant.
Unfortunately, there is limitations to the TPS. Unfortunately, there's limitations to RTMS.
That is amazing.
The reason why we're targeting the central regions, but we cannot target the peripheral to get a connection between central and peripheral. The only system out there right now is Neuronica. The only system using tDCS. And you can see how happy he is.
Look at this. Amazing.
He can control. I asked him how long has it been since to walk. There you go again.
So how long has it been?
It's been a while. Now we're targeting the cerebellum.
Now he's got anode.
There it is, where the atrophies. CB1, CB2, and we put the cathode for the down.
T5.
Now he's walking a lot easier. There's no foot drops. There's no spasticity. So you can see the power of cortical spinal tracts, integrating both the central and the peripheral. Where current flows, blood flows. Where current flows, blood flows. And we're activating stem cells. We know this from other research.
Amazing.
That we are targeting their own neurostem cells from the cerebellum and neurons in reserve.
So how long has...
Now, we're going to go to an ALS patient. I'll be very fast. I'm not going to describe all this anatomy. If you're interested, you can join SOZO along with Thailand, basically Mrs. Urathay, and we go. As we know about Stephen Hawkins, was diagnosed with it. I will show you a case that he's been living now with ALS for more than 6 years. More than 6 years. He's been using Neuronica for the last 3 years. So I'll show you this patient.
Here's a gentleman with a motor neuron disease. Let's go.
He was diagnosed here 2 years before. The life expectancy is 2 years, 50%.
3 years now, 1 year fully diagnosed.
So that's Mr. Chris from the United Kingdom. Now that's Chris in 3 years.
Okay, good.
He can still walk. His neurons and neurofilaments, they're not being destroyed.
Just walk down the corridor.
And you can see now it's been 3 years with ALS and he can still function by using a 2-channel and with neurotracks. We don't only use Neuronica with this patient, we also use vagus stimulation. Vagus stimulation stops 70% of the progression of the neuroinflammation of the brain. So it stops the TNF factors,